Good morning to everybody. My name is Leonardo Narvaez, and the title of my research project is Latest Trends in Surface Modification for Dental Implantology, Innovative Developments and Analytical Applications. This article is a bibliographic review which defines concepts and explains the research on engineering strategies for dental implants that has focused on the implant material composition, geometry, and surrounding tissues. In the same way, special interest has been created in the inclusion of superficial coatings since they improve osseointegration and minimize the appearance of periimplantitis and associated risks. As we can see in the picture, the demand for dental implants has increased due to their aesthetic and functional characteristics. The 90% are successful after 10 to 15 years of implantation, but the 10% fail because of mechanical causes, periimplantitis, or bacterial colonization, which has increased the search for innovative materials that end the problem. To better understand this article, I will explain some concepts. The first one is periimplantitis. It's defined as a pathological condition associated with plaque that is present around the implant tissue, causing inflammation in the periimplant mucosa and progressive loss of bone support. Periimplant bone loss greater than 1 millimeter in the first year of implantation and greater than 0.2 millimeters in the following year is considered dental implant failure. The second one is osseointegration. It's triggered by a cascade mechanism starting with interfacial reactions between the implant surface, the blood cell, and connective tissue to end in the formation of new bone. Referring to the composition of biomaterial, the most important properties that the biomaterial must have are modulus of elasticity, tensile, compressive, and shear strength, ductility, surface tension, surface energy, and superficial roughness. Metals, ceramics, and polymers have represented the materials of dental choice. Polymeric materials have only been used for fabricating shock-absorbing components because of their low strength. Among ceramics, hydroxyapatite is the most used because of the great biocompatibility and capability to help the osteoblast activity because it has a similar composition to the mineral structure of the bone. In metals, titanium and its alloys are the most used materials because of their osseointegration capacity. The strategies to obtain bioactive topographies with surface modification in the implants are sandblasting, laser radiation, acid etching, anodizing, and plasma spray. Referring to the coatings of implants, the biocompatibility, osseointegration, and therapeutic antibacterial effect have been considered as one of the most important factors for the long duration of implants. These novel coatings have been divided into two groups, organic and inorganic. Non-structured calcium, calcium phosphate, and hydroxyapatite have been the most used through the plasma spraying technique since they release calcium and phosphate ions. The ones that stand out are graphene and bioactive classes. Graphene is the one of the new coatings due to its electronic and mechanical properties and antibacterial activity against gingival porphyromonas and mutants streptococcus that are usually found in dental plaque. Bioactive classes has a higher Young modulus, helps osseointegration, biofunctional, administer drugs, and produce hydroxyapatite. As a conclusion, we have the following. Bioglass has the best characteristics compared to other materials, which improve osseointegration, drug delivery, biofunctionality, and faster healing of the bone. The composition of the biomaterial of the implant, the surface and geometry allows to achieve osseointegration after an implantation surgery. The best strategy to obtain bioactive topographies is the combination of laser radiation and acid etching. It helps to generate antibacterial surface, corrosive resistant, cell recruiting, and faster healing bone. Thank you very much.